Willoughby.
Thank you, Mr Deputy Speaker, and I'm pleased to be speaking on this bill for the co-payment for the PBS. I thought I might start in my speech in drawing to the House's attention a report by the Commonwealth Fund, which was released in the middle of last year. And the Commonwealth Fund puts out regular surveys of countries looking at their health systems and how they compare. And they've recently expanded the number of countries that they look at. So now they look at 11 countries, UK, New Zealand, Canada, US, the Scandinavian countries, France, Germany, as well as Australia. And what it shows, it's consistent with all of the previous reports from the Commonwealth Fund, that Australia's health system does stack up very well. We stack up well on people enjoying healthy lives, long life expectancy. We stack up well for the quality of care. We're seen as having an efficient system. We're seen as having a fair system. And this is despite the fact that we still have one of the lower spendings in health per capita. And on the 2011 figures, $3,800 per capita compared to the United States, $8,508. In fact, of the 11 countries, only the UK or New Zealand spend less. So let's just put some reality into this debate and just remember that we are a healthy country, we have a good health system, we have an efficient health system. And it's in that context that we need to consider this measure. Now, the Pharmaceutical Benefits Scheme has been one of the fastest rising areas of Commonwealth government expenditure. We've seen it increase dramatically over the last 15 years. And it's in this context that the government has made a decision to increase patient co-payments in this budget and increase the safety net thresholds for this Pharmaceutical Benefits Scheme. It is a savings measure, involves savings of approximately $1.3 billion over the next 4 years. And those savings go towards the Medical Research Future Fund. Now, we're still going to see more spent by the government on the PBS. It's going to go up from $9.2 billion in the last financial year to $10.2 billion by the last year of the forward estimates. And this involves a one-off increase in patient co-payments. Now, when we talk about co-payments, there has been a co-payment for the Pharmaceutical Benefits Scheme since 1960. When it was introduced in 1960, there were very few of the advanced drugs that we see now. It was a much simpler Pharmaceutical Benefits Scheme, but all the same, we had a co-payment introduced, probably when Harold Holt was the Treasurer in the 1960 federal budget. It was the Labor Party which introduced the co-payment for concessional card holders. So Bob Hawke and Brian Howe and Jenny Macklin in another incarnation, all of them understood, the member for Canberra, all understood the need for a patient co-payment. Now, with this proposal, for general patients, the co-payment, which sits at $36.90, will increase by $5 in addition to movements on the CPI. Now, on average, general patients use 2 PBS subsidised prescriptions per year. So what this means is that for the average user who's not a concession card holder, they'll contribute an additional $10 per year themselves. Now, for people who have concessional cards, the co-payment, which is currently $6, will increase by 80 cents in addition to the CPI. Now, people with a concessional card, on average, use 17 scripts each year. And under the new arrangements, they'll pay $13.60 per year for their subsidised medicines. Now, there are a number of medicines that are already less than the current general co-payment, and that accounts for more than 40% of PBS listings and more than 70% of general patient prescriptions. So what that means is that for these patients, for these scripts, the increase in the co-payment will have no effect. Just take amoxicillin, a common antibiotic currently costs $13.85. It's well below the PBS copayment. Now, after increases in the general copayment, there will be no impact on the price of amoxicillin. Now, by the time the copayment changes come into effect, 1st of January next year, more than 55% of listings will be below the general copayment amount. Now, we also need to mention that that the government does still continue to contribute the majority of the cost of many pharmaceuticals. Insulin, common treatment for diabetes, has a cost through the PBS of around $220, for which only $6.90 is covered by concessions, or $42.70 for general patients. Over the last decade, we've seen the cost of the PBS increase from $5 billion to around $9 billion. It's expected to continue at around 4 to 5% per year, but a decade ago it was growing at 11, 12, 13% each year. So this is a simple measure which is about sustainability of the PBS. We constantly, as members of Parliament, are made aware of new pharmaceuticals that are coming to the market, that are going through the hoops of being passed by the TGA, by the Pharmaceutical Benefits Advisory Committee, and then by the Pharmaceutical Benefits Pricing Authority. And it's important that Australia does need to be able to bring these medicines to consumers in a sustainable way. And let us never forget the debacle of drug listing that occurred under the previous government. I will never forget going to a Medicines Australia dinner where the industry minister said that the government would cease to list drugs on the PBS until the budget was in surplus. It's something that no federal government had ever tried before. It was not sustainable, and it lasted about 6 months. But what it did was create massive uncertainty about the listing process. When we look at some of the newer drugs, some of the tyrosine kinase inhibitors used in the treatment for melanoma can cost up to $110,000. Advanced breast cancer, some of those similar drugs can cost around $38,000. Drugs for prostate cancer can cost around $27,000. And there is an expectation for people who have melanoma or breast cancer or prostate cancer that the government will be able to fund these, and will be able to fund these in a sustainable way. So to increase the PBS copayment, this has been done in the past. As I said, the concessional copayment was first introduced by the Labor Party in the 1991 budget. The savings that we make will go towards the Medical Research Future Fund, and this is a very forward-looking fund that means within 6 years Australia will have the largest capital fund in the world dedicated towards medical research. When fully mature in 2022, it will mean a doubling of the investment that we make in medical research. It will benefit all of our excellent medical research institutes, and will add an extra $1 billion each year to support our world-class Australian researchers. Since the Abbott government came to power, we've listed or expanded the listing of 181 new medicines on the PBS. We're listing medicines. We've not had a repeat of that unfortunate episode under the previous government, where they simply stopped listing because they couldn't afford them. The previous government, when we were previous in, the Howard government, introduced price disclosure for pharmaceuticals, which has been a very important step in putting the PBS on a path to sustainability. Now, when Labor were last in power, they promised stability for the PBS, but instead it was a complete chaos. They deferred the listings of medicines already recommended by the Pharmaceutical Benefits Advisory Committee. Patients suffering from schizophrenia, chronic pain, lung disease and others had their medications delayed for months under the previous Labor government. They politicised the PBS listing process and undermined the independence of the PBAC. What we've done is restore the independence of the listing process, and their recommendations will no longer be ignored. As I said before, Labor in government have supported increases in the PBS co-payment. In 1986, they actually doubled the PBS co-payment for general patients from $5 to $10. They introduced a PBS co-payment for pensioners. And in 2004, they supported a one-off increase to the PBS co-payments. That was the famous backflip by the then leader, Mark Latham. So the Labor Party have shown that they do support a PBS co-payment and do support increases in a PBS co-payment where it's appropriate. Now what we see is they're being opportunistic. I think this is a good example of what Paul Kelly described in the Australian, of how the politics is not rising to the challenge which we face, that the Parliament is not rising to the challenge that we face in having a sustainable budget, in restoring a budget to surplus, and in making sensible measures which will provide sustainability to our Commonwealth programs into the future.